Hello and welcome to Video3 Newsline. I'm Annalise Broughton. Today's programme is focused on the Scottish Ambulance Service and the amazing and often life-saving work that they do. We'll be hearing from Chief Executive of the service, Pauline Howie, a little bit later on. But first we're going to focus on the online training that has improved the service over the last 2 years. We're joined by Brian Glass, Regional Head of Training for the North. Brian, thanks for being here tonight. So what type of CPD requirements do you need to deliver to paramedics?
Paramedics are registered with the HCPC, which is the Healthcare Professional Council. They're also required as a registered professional to complete various types of CPD to meet the 5 standards of continual professional development. This is to ensure that they deliver current and up-to-date practice and maintain a portfolio of evidence. Our technicians will complete the mandatory learning outcomes required provided by the service. Additional CPD, however, will enhance all their knowledge and skills and can be used as evidence in all portfolios to demonstrate that they're maintaining their skills and knowledge, and a requirement is to move towards developing their careers in the service.
So why do you feel there's a need to deliver your CPD online?
As a service, we have 1,600 paramedics and 1,300 technicians in service spread over all of Scotland. It would be virtually impossible to arrange face-to-face CPD sessions for them all. Although there is a lot of local CPD facilitated in areas through local contacts and volunteers. However, to get CPD sessions available to all staff from, say, Dumfries to Shetland, we look to trial webcast sessions and increase our online CPD.
So 2 years in, how has the online delivery of CPD been received?
We facilitated a number of webcast sessions over a 12-month period. Then we distributed a survey for all staff to complete. In addition, we provided with the viewing figures, which were very good. Feedback and comments have been very favourable. This justified the cost and has been the decisive factor for our department to fund a further 10 sessions and other online CPD programmes.
So what do the staff in particular like about the online training?
Okay, initially the webcasts were streamed live and the subject specialist took live questions, which was welcomed. The session was then placed in archive for staff to watch at any time, from work or from home. In addition, we have learning programmes through LearnPro, which staff can access any time at work or from their own home. I think they like being in control of when to undertake the CPD online. So,
on the other side of the coin, Brian, what, if anything, don't they like? Is there anything you'd like to see in terms of online training?
Yes, there can be difficulty in broadband width, access, drop-off and buffering, which does cause frustration for staff in certain areas. Going forward, it would be good for to have the most up-to-date technology in place, whether it's Glasgow or in Stornoway, so we can get best from interactive content.
Well, that's very important, of course. So how do you go about choosing the topics?
This is done in a variety of ways. We look at what is the current topic, such as dementia or sepsis, or any service developments. Also, feedback and requests are collated from staff. Then, as a department, we will review and select the topics for the number of sessions available.
So how difficult is it to organise and schedule CPD?
Once a topic is identified, we have to look for a subject specialist to deliver it, such as a cardiologist for a previous ECG session. All clinicians provide their services voluntarily. The next step is matching the availability within diary commitments, sourcing a suitable venue, agreeing to a time slot and hoping there's no last minute issues, such as the clinician is still on call or late out of theatre, which has occurred, so it can be a bit challenging behind the scenes to arrange.
Finally, Brian, how would you like to see online training develop in the future?
Advancement in access technology will affect not necessarily the session arrangements, but the viewing access and the interactive content of some sessions now. Being able to access them via mobile phones, apps, tablets, as well as the computers. And indeed, we need to keep up with technology. The easier it is to access, the more staff will view and participate in the CPD sessions.
Brian, thank you. Pauline Howie has been Chief Executive of the Scottish Ambulance Service for the past 7 years and has been kind enough to give us an insight into the work that they do. Welcome, Pauline. Thank you for talking to us tonight. So, Pauline, what's new with the Scottish Ambulance Service?
We're fundamentally changing our model of service delivery. Our new strategy towards 2020, taking care to patients, does what it says in the tin. We're changing the model of service delivery so that we can take care to patients rather than taking patients to care. We've identified about 40% of patients can be safely cared for in their homes or in their community settings, and that requires us to enhance the skills and the training of our staff and to develop, with integrated health and social care and partnerships, alternative pathways of care so that we can easily refer patients into those pathways. such as, for example, elderly people who have fallen but aren't injured.
So you talked a bit about partnership working. Can you expand on that?
We work very closely with the integrated health and social care partnerships across the length and breadth of the country. We've got local divisional management teams that are engaged at a variety of levels with the IJBs to identify which pathways already exist and to also work closely to identify new pathways. And it's particularly important that we have those pathways in place at the times when patients need them, which often isn't in the in-hours period, but in the overnight or at the weekend period. We work also closely with our other emergency service colleagues, for example, with the Fire Service and Police Scotland in the delivery of Scotland's out-of-hospital cardiac arrest strategy. This is a really ambitious strategy to save 1,000 more lives by 2020, and it requires a whole nation approach. So we've got an ambitious target of, between us, saving 1,000 more lives through a variety of actions such as training 500,000 people in CPR, for example. And I was delighted that councils recently have been increasing the provision of public access defibrillators in sports halls and other civic amenities, for example.
So with all these changes, how has the role of the paramedics changed?
The paramedic role continues to expand. We were delighted that the latest Scottish Government programme for government confirms its commitment to train 1,000 more paramedics to work in the community in the Scottish Ambulance Service over the next 5 years. And within that cohort of people, there'll be a range of roles. So specialists and advanced paramedics that can have their own caseload, working as part of a primary care team, taking more care to patients. We are advocating for paramedics to have prescribing rights, which again will enable us to keep patients at home, which is where the vast majority of them want to be. We're dealing with more and more frail and elderly people, and they want to be cared for in their own homes and return to independent living as quickly as possible.
Now, we read more and more about alcohol-related abuse towards paramedics and other frontline services. How are you dealing with this?
Alcohol abuse is a major factor. Our paramedics and other crews tell us that about 2 out of every 3 calls over weekends can be alcohol related. Often, most people are perfectly civil with our staff, but unfortunately there are a minority of people who do abuse our staff, whether that's physically or emotionally and verbally. And we have a zero tolerance approach. We encourage all our staff to report any incidences of abuse to our ambulance control and to police control so that those people can be appropriately dealt with. But there's no doubt that we need to do more collectively as a public service and between public and voluntary services in Scotland to try to tackle the abuse that all our emergency services crews face through alcohol. We're working very closely with Police Scotland and with Scottish Fire and Rescue Service to identify the cost of alcohol on our staff and on our resources across all of Scotland.
The ambulance service is very highly regarded by the Scottish public. What do you feel is the biggest achievement of the service?
The Scottish Ambulance Service is a national asset. It operates 24 hours a day, 7 days a week, 365 days a year, in all weather that's thrown at us throughout the length and the breadth of the country, including its inhabited islands. And its greatest asset, of course, is its staff. We employ over 4,600 highly committed individuals. To them, the service isn't a job, it's a vocation, and I'm really proud of each and every one of them. We also work really closely with community first responders. We've got about 1,500 community first responders, not just in rural areas, but in the cities and the more urban areas too, and they do a fantastic job in supporting our staff to provide the very best service we can to patients across the whole country.
So we understand that you're recruiting another 200 paramedics. What do you feel is the greatest challenge for the future?
The greatest challenge will be to continue to adapt and evolve our service to meet the changing needs of the country. We can't do that in isolation. We need to continue to work across all of health and social care services, and we're all needing to reform in order to enable us to have the infrastructure and the relationships and the capability to deliver the ambitions that the Scottish Government has set for us all. I've no doubt that the people within the Scottish Ambulance Service absolutely come in to do their very best every single day, and we're committed to working with our partners across the communities of Scotland to enable us to deliver a healthier, wealthier and happier society in Scotland.
Now, in an organisation of this size, communication is obviously very important. Why do you deliver your quarterly briefing online?
We are a distributed service, we're a shift working service as well, and it's impossible for me and my board colleagues to get out and see every single member of staff every year. We try and get out as much as we possibly can, but the quarterly WebEx type briefing is just another tool to enable me to directly engage with staff, and it's a two-way conversation. We actively encourage live questions, and anybody that isn't able to join on the day, then they can submit questions at any time. And we try to theme up the quarterly briefings to be relevant to how people are experiencing delivering the service at that particular point in time.
How would you like to see closer cooperation with the Scottish Fire and Rescue Service?
We have a really good relationship with the Scottish Fire and Rescue Service. They're a key partner in terms of delivery of the out-of-hospital cardiac arrest service for Scotland, and we have 9 test sites in place where the Scottish Fire and Rescue colleagues are helping provide a response to those patients that are identified as suffering from cardiac arrest. We're really hopeful that that can be extended across the country and potentially into some other high acuity conditions. We also work very closely with them in terms of sharing some of our estate and some of our back office systems, and are looking at some joint procurement, for example, too. So there's no doubt that closer working between all 3 of the emergency services, and indeed with other public service partners, is the way to go.
As Chief Executive of the Scottish Ambulance Service, what do you feel is the most humbling thing about the service?
The most humbling thing about the service is our staff. Nothing makes me prouder than when I receive a comment or a letter or a phone call from a patient that tells me the fantastic service that they've experienced from our staff, and I get hundreds of those. There's no doubt we are a national asset. We make a real difference to people every single day, and I am really proud and humbled to be able to play my part in the delivery of that service.
Pauline, Howie, thank you very much. As you can see, the Scottish Ambulance Service really are at the forefront in the way that they communicate with and train their service members. If you would like your organisation to appear on Video3 Newsline, then please contact us through the information on the screen. From the team at Video3, thank you for watching, and we'll see you next month.